Okay, so in this third short video on information failure, I want to take a few minutes just to think about the anti-vaccination movement. It's one of those highly topical issues. I think you can link quite well to the economics of information failure. Despite overwhelming evidence of the effectiveness and safety of vaccinations, I think it's clear to see that a growing number of people in, for example, the United States and a number of European countries are reluctant to receive the recommended vaccinations or refuse them altogether. This is sometimes known as the anti-vac movement. And what lies behind it? There's many factors. In some cases, it's a predominant religious faith, lack of trust perhaps in experts, conspiracy theories abound on the internet. Sometimes it's more prosaic reasons, the cost of travelling and the inconvenience of getting to vaccination centres. And crucially, I think in certain cases, a suspected link to other illnesses. The crucial example to use probably is the fear that some people have when they're taking the MMR vaccine for measles, mumps and rubella, that there's a suspected link to autism amongst children. There's also lots of other reasons. The echo chamber effect. Typically, the confirmation bias kicks in. People who have a mistrust of things try to find information to confirm their view. Fundamental information failures is absolutely crucial to this, in particular when people are given access to information which is essentially fake news. This chart is quite revealing. This is from the Wellcome Global Monitor 2018, which tries to track knowledge and attitudes towards vaccinations in the UK. And you can see that 97% of people have heard of vaccines. I wonder what the other 3% were doing. The vast majority of people think it's important for children to have vaccines. 86% of people think that vaccines are effective. But there's a sizable minority that fear, that have an uncertainty that vaccines are safe. 75% of people think they're safe. 25% of people have their doubts. And if you look at a survey of general practitioners, this survey comes from 2018, survey conducted by the London School of Hygiene and Tropical Medicine, and it's a survey of GPs, general practitioners operating in the health system. Again, 99% of GPs think the MMR vaccine is safe. 99% think that the seasonal influenza flu vaccine is safe. 96% of GPs think the vaccines are effective, but 5% of GPs think the vaccines are unsafe. There's a high level of trust amongst GPs, but it's not complete and uniform. Again, some data here. This is NHS Public Health England data, 2019. Proportion of children who have received the MMR vaccine in the UK by country of the UK. So the vast majority of children receive the vaccine, the first dose by their second birthday, and even bigger, as you'd expect, bigger percentage receive it by their fifth birthday. Although in England, 5% of children haven't received the first dose by their fifth birthday. That figure is highest in England. So the percentage of children not receiving the vaccine is highest in England, lower elsewhere. But oftentimes you need a second dose to make the vaccination effective. And I think you can see from this chart, if you look at the grey bit of the histogram, that something like 13% plus of children in England have not received a second dose by their fifth birthday, which of course the second dose could improve the effectiveness of the vaccine. In 2019, the World Health Organization, the WHO, actually named vaccine hesitancy as one of the 10 leading threats to global health. And there's some evidence, by the way, that vaccine hesitancy, perhaps as a result of information failure, information gaps, has led to a resurgence of diseases such as measles, particularly in countries that were close to or had thought they had already eliminated them. This is a revealing chart from 2016. This was asking families in the United States, the reasons they gave healthcare professionals for refusing vaccinations. Actually, only 8% said it was the cost or lack of insurance coverage. 23% said the doubt about vaccine efficacy or effectiveness. A third of people, yes, it was religious or political belief, some people believing that naturally acquired immunity, herd immunity was preferable, and so on. But look at that jump. The worry that the child will suffer other complications from the vaccine, concerns about added ingredients in vaccines, and the highest, 77%, of those who refuse vaccinations, which of course is still a minority, is the fear of connection to autism spectrum disorder. This again goes back to the Andrew Wakefield paper, now discredited. Wakefield is now a disgraced doctor, but sometimes fake news, fake information can spread, particularly on social media, which has a serious, damaging, deleterious effect on vaccination uptake. And I leave this chart with you. This chart shows the number of new cases of measles in the United States. There was a pickup in 2014, then dropped down again. But of course, in 2019, the number of new measles cases, well, double the figure in 2014 and increased by a factor of 3, nearly 4, from 2018 to 2019. The anti-vaccination movement is the result of a number of information failures, information gaps, but it has consequences for public health.